Hi, Cousin Adam. Can I interrupt your rest time for a while to ask a few questions?
Hi Lily. It's not a big deal. What questions do you want to ask?
Thanks. I'm currently doing some project regarding Parkinson's disease. I would like to know more about the current medication used to treat this disease.
I understand. A combination of carbidopa and levodopa is usually prescribed to treat the symptoms of Parkinson's disease. These two drugs are formulated into an immediate-release tablet called Cinamate. These medication comes in three strengths: 10 mg carbidopa with 100 mg levodopa, 25 mg carbidopa with 100 mg levodopa and 25 mg carbidopa with 250 mg of levodopa. The extended-release tablet is known as Cinamate CR with also two different choice of strengths. Duopa is the extended-release enteral suspension for this drug. It is packed in a 100 ml single-use cassette containing 4.63 mg carbidopa and 20 mg of levodopa per milliliter.
What about the mechanism of action?
Levodopa acts as the metabolic precursor of dopamine, whereas carbidopa acts as an inhibitor of breakdown of levodopa by inhibiting aromatic amino acid decarboxylase. This increased the availability of levodopa at blood-brain barrier and lower levodopa doses allowed.
Can you tell me more about the pharmacology of this product?
The peak concentration of Cinamate CR is 35% of the Cinamate. About 36% of carbidopa and 10 to 30% of levodopa are bounded to the plasma protein. The volume of distribution of levodopa is between 0.9 to 1.6 lito per kilogram in the presence of carbidopa.
I have heard that every drug has its side effect. What about the adverse effect of the combination of these drugs?
Yes, of course it does. This medication can cause adverse effect on several systems in our body, including genitourinary system and cardiovascular systems. The most common side effects are dizziness, nausea, headache and involuntary movements.
Since there are so many side effects, is there any alternative drugs?
Yes. We do have other drugs as well. One of them is pramipexole.
What is its mechanism of action?
It can stimulate the dopamine receptor in the striatum and mimic the effect of dopamine in the brain. It also have anti-apoptotic actions and neuroprotective effects as it prevent the decrease in the mitochondrial membrane potential induced by MPP and rhodonone.
Okay, then how about the pharmacological aspect of this drug?
Pramipexole is well and rapidly absorbed by the body with bioavailability of more than 90%. It undergo first-pass metabolism and the peak concentration achieved after 2 hours. 15% of the drug bound to the plasma protein and 90% of the dose is eliminated as the unchanged drug through urine.
What is the dose recommendation of this drug?
For immediate release, the initial dose should be given as 0.125 mg for 3 times a day, while for extended release, the starting dose is 0.375 mg once a day. The dose can be increased gradually after 1 week until it reaches the maximum dose allowed, which is 4.5 mg a day for both kind of release.
What about the adverse effect of this medication?
Common reported effects are nausea, hallucination, asthenia, dizziness and sleeping problem. The drug can be taken with food to reduce nausea, while pregnant and lactating mother should consult with doctor before taking this medication.
Okay. I think the information you provided me today is sufficient. Thank you for your help, Adam.
I'm glad I can help.